Shipbuilding, mining, construction, foundry, and forestry work are some of the occupations where the use of handheld vibrating tools is a vital part of the job. The force generated for work by these tools can be very high, but part of that energy is transmitted to the operator, where it can cause painful disorders in the hands and upper limbs. These conditions are referred to collectively as hand-arm vibration syndrome. Smaller tools that vibrate may be just as damaging as large ones. The exposed worker may experience effects ranging from occasional discomfort from cold to more serious effects, such as tingling and numbness that do not go away, finger blanching, and pain. Frequently, victims have trouble sensing objects and textures with their fingertips. The problem is progressive. In later stages, it may lead to loss of dexterity of the fingers. Dr. Martin Cherniak, assistant professor at Yale University Medical School, has examined over 300 workers suffering from vibration exposure. He describes the white finger syndrome that occurs in some victims.
White finger. And again, what people frequently describe is their fingers turning white in the cold and being quite painful. These episodes usually occurring, although not in all cases, in discrete attacks where frequently on first exposure to cold in the morning when they leave the home, and then again on tool use, fingers will turn white. Progressively, there's almost a kind of working down the finger from distal to proximal. And these will generally respond to rewarming, but again, the severity and the frequency seems to increase over time.
The attacks last from 5 to 15 minutes. They are usually brought on by cold, by the morning air, for example. The attack may be relieved by warming and massaging the affected parts. How fast symptoms progress depends on exposure time and the cumulative vibration dose. The time between first exposure and the first sign of whitened fingers may vary from 6 months to 25 years. In general, the shorter the interval between exposure and symptoms, the more severe and rapidly progressive the symptoms are likely to be. The effects of vibration on workers has received research attention in many industrialized nations. Dr. Alice Hamilton, an occupational health pioneer, drew attention to vibration as an occupational hazard in 1918. In her study of Indiana limestone workers, one of the first assessments of the problem, she found more than 80% of the workers had vibration-related symptoms. A study was done by the National Institute for Occupational Safety and Health among a similar group in 1978, 3 generations later. It showed that workers face the same problem today. It is estimated that there are over 1 million workers exposed to hand-arm vibration in the United States alone. Prevalence of symptoms is commonly between 50 and 60% of the exposed population. In many countries, the signs and symptoms are recognized as a compensable condition. The United States is not currently among this group, although there are a number of cases pending in its courts. Many workers are exposed to vibration through surfaces that support them as they work. Shipbuilders and heavy earth-moving equipment operators experience this. It's called whole-body vibration. Because it has different effects on workers, we will separate this type of exposure from vibration stimuli to the worker's hands and arms, known as segmental or hand-arm vibration. In the rest of this program, we'll look at tool vibration, its medical consequences for workers, and how to reduce the risks of using these tools. First, let's look at vibration itself. A vibration is a cycle of specific activity. A complete cycle through both extremes of movement occurs at a particular speed. The number of cycles per second is the frequency of vibration and is expressed in hertz. Vibrations from this tool with frequencies of 10 hertz or higher are absorbed by the hands and wrists. Lower frequencies are transmitted through the hands up the arms to the upper limb joints. Another component of vibration is acceleration. The speed of a vibrating object's travel is almost constantly changing in order to reverse direction. The time rate of change of velocity is acceleration. It is expressed in meters per second, or meters per second squared. Another unit that is frequently used is gravity, or G. 1 G is equal to 9.8 meters per second squared. This chipper delivers 2,100 impacts per minute. On each stroke, the cutter develops an acceleration of around 2,000 Gs. The operator must grasp the handle tightly just to trigger the tool, but he or she must also hold it upright and guide it. Consequently, the worker is subjected to a greater percentage of this vibration energy. One more thing is important to an understanding of vibration's effect on the worker: resonance, or the body's tendency to act in concert with external vibration and exacerbate its effects at certain frequencies. For the hand-arm system, resonance is thought to occur between 100 and 300 hertz, which is the range of many tools. Currently, we can only theorize about the way hands react to this trauma. Vibrations may damage the nerves, blood vessels, joints, and muscles of the hands and arms. Nerve endings can be damaged, causing the tingling and numbness we mentioned, and the loss of feeling at the fingertips. The damage may in turn cause the hand's small arteries to narrow and restrict blood flow. A breakdown of the intima, the inner wall of the veins, may also occur. The shear force applied allows some of the blood constituents to escape into the surrounding vessel coatings. Changes in any of these systems, the nerves, the blood vessels, the muscles, and joints, may be independent of each other. They may also be as a result of interaction. In addition to vibration stimulus itself, other external occupational factors are weight of the tool, grip force used on the tool, the use and type of gloves, the condition of the tool, and cramped or awkward working postures. Another factor is whether exposure is continuous or intermittent during the shift. Another is the time of exposure to vibration. As sure as vibration is the stimulus, cold is the provocative factor. The job's climate, including humidity, and the temperature ranges the worker is subjected to contribute to the number and severity of attacks of symptoms.
We're quite sure, and we've seen evidence, that if we take a Florida worker using pneumatic tools and we move them to New England or the northern Midwest or even the Pacific Northwest, we find that they now rather rapidly develop a vascular condition. Obviously, they haven't rather rapidly developed it, but this is a cold-dependent condition.
Studies have also shown that smoking aggravates symptoms. Nicotine constricts the flow of blood to the fingers and toes. The combination of vibration, cold, and smoking is especially hazardous.
There are numerous reasons of why workers shouldn't smoke, and really the general population shouldn't smoke. The exposure to vibration, whether symptoms are present or not, but particularly if they're present, is one more good reason.
This foundry worker's experience is fairly typical of vibration white finger victims.
I worked in the foundry approximately 15 years, and I started out as a chipper and a grinder. And as chipping and grinding, from running the grinder and chipper, my hands would start tingling and then numbing feeling. And it would take a few hours after the 8-hour shift for my hands to come back to normal. I chipped and grinded for approximately 8 years, and then I bid on a core maker's job. And I made cores for around 3 years, and then my index finger went numb, it started tingling, and it ulcerated, and they turned white. And after that, I couldn't run any vibrating tools anymore, so I took a lower paying job as a material handler. And it interfered with a lot of my activities at home, like even sports like fishing and hunting. In the winter, I can't get out when the temperature drops. My fingers would be painful and turn white.
In the early 1970s, Doctors William Taylor and Peter Pelmier were working together in the United Kingdom on the white finger problem. After examining many workers suffering from the use of vibrating tools, they developed a scale to classify the extent of a worker's illness. The first stages involved symptoms of tingling and numbness in one or more fingers. With continued exposure to vibration, the symptoms advanced to include whitening of one or more fingers. If the insult to the body persisted, leaving the job was a later stage. In the most severe cases, which rarely happen, gangrene may occur. This classification system has served both the medical and scientific communities for many years. In the mid-1980s, after a number of physicians had reported seeing numerous patients who did not progress beyond the symptoms of numbness or tingling, in spite of continued use of vibrating tools, the Stockholm classification system emerged. Now doctors assess the damage to both the neurological system and to the blood vessel or vascular system in each hand separately, so that at each assessment, 4 different grades or classifications are given. For an accurate diagnosis, a doctor must have information about previous tool use and whether symptoms occurred before or after first vibration exposure. An up-to-date occupational history is essential. Lacerations and fractures are common in these tool users. These trauma often affect digit circulation, so a doctor's examination of the fingers is advisable. Hypertension, arteriosclerosis, diabetes, arthritic conditions, and collagen diseases interfere with circulation and must also be excluded as causes of the symptoms. There are other conditions that may confuse a doctor's diagnosis. They must be systematically eliminated. To date, there is no single, reliable screening test for vibration exposure cases, but there are a number of tests which, when used together, help provide a more accurate picture of a worker's condition. This is a segment from a program produced by the Ministry of Labor of Ontario, Canada. It features the tests that are done in their clinic, overseen by Dr. Peter Pelmier. Following an initial examination, a sophisticated series of tests are administered in the ministry's lab by trained personnel. A function of the central nervous system can be assessed by the use of a vibrometer. This is used to establish the patient's threshold response and sensitivity to vibration. To get an assessment of the motor sensory response, an electrical stimulus is applied and the time of conduction is measured. The target points are from the finger to the wrist and from the wrist to the elbow, which makes this procedure also effective at discerning carpal tunnel syndrome. Next, the blood flow is checked in 4 stages. In order to evaluate the large arteries in the arm, pressure measurements are taken at different points in the arm using a Doppler. To obtain pressures in each of the digits, Velcro strips with an encased photocell are wrapped around each finger. A graph recorder registers the flow through all digits. The third test involves obtaining pressure measurements in a control and in a test finger simultaneously. Then, an alternating hot-cold water line running through the cuff on the target finger is used to measure blood pressure changes in relation to temperature changes. A cold water blanket may be worn by the patient to complete this procedure. Finally, the last test to evaluate the vascular severity may also produce the white finger blanching. The patient is wrapped in a warming blanket to keep the baseline constant. Each finger has a thermometer attached that feeds data back to a chart recorder. Then the hand is immersed in cold water. The small plastic balls help to keep the temperature at a constant 10 degrees Celsius. Readings are taken for a period of time while the hand is in the bath and after it is extracted. The result becomes easy to see. There are other tests, but they seem to be less reliable, and some involve invasive procedures, such as brachial arteriography. In this arteriograph, you can see a breakdown of the blood vessels in the tips of all the fingers of this grinder's hand. Notice by contrast the supply of blood to the thumb. There's also evidence of bone density reduction. Is there any safe exposure level for vibration? The National Institute for Occupational Safety and Health published its criteria for a recommended standard for occupational exposure to hand-arm vibration in 1989. In addition to their recommendations, they outline the domestic and international guidelines currently available. They are a guide to safe values for vibration frequency and acceleration for different periods of exposure, and generally share the assumption that vibration frequencies above 16 Hertz are not as hazardous as lower frequencies. However, recent studies suggest that frequency weighting of these curves may not adequately protect workers. Ongoing research is attempting to resolve this issue, and in the meantime, these curves should be used with caution, especially when high-speed, high-frequency tools are concerned. To use the standards, you must have a measurement of the vibration spectrum the worker has been exposed to. New equipment allows the attachment of accelerometers to tool handles. They provide what amounts to a fingerprint of the tool's vibration characteristics. This is an important step in collecting further data needed to improve dose-response relationships. The first and best line of defense against injury is better tool design. Chainsaw manufacturers have greatly reduced the vibration generated by their tools through engineering advances. A good example of this effort is this anti-vibration chainsaw developed between 1970 and 1972. Part of this saw is suspended by these small rubber shock absorbers, which reduce the vibration before it reaches the handle and the operator's hands. These saws have resulted in falling incidents of hand-arm vibration syndrome where they have seen wide usage, especially in Europe. Some manufacturers have been very successful in reducing tool vibration. They're using innovative damping and isolation methods to minimize the vibration reaching the tool operator's hands. Cases of vibration white finger are still appearing, though, and more engineering must be applied to vibrating tools to reduce the stimulus to a minimum. Careful maintenance of vibrating hand tools can help. The use of gloves will help keep hands warm and dry and may eliminate 10 to 15% of unwanted vibration. Different types of gloves are available. They should be worn not only to reduce exposure, but to keep the hands and fingers warm. They also serve to reduce cuts and lacerations. Another factor to consider is the grip force used to operate the tool. The more tightly a worker grasps the tool, the greater the exposure to vibration. The worker should be encouraged to let the tool do the work, grasping it as lightly as possible, consistent with safe work practices and tool control. Operating at reduced tool speeds is another way to reduce vibration. Instruction in the correct use of these tools can instill work practices that will pose the least danger to the worker. The hazards of vibration can be reduced by work schedules that include rest breaks, for example, 10 minutes per continuous vibration hour. When beginning work with vibrating tools, the worker must be warned of the hazards. Diagnosed hand-arm vibration syndrome subjects should be medically monitored routinely, at least once a year. Those workers should be encouraged to see a physician if they notice signs and symptoms of deterioration. This is often a very difficult situation. Researchers have found that if exposed workers are detected before stage 2 and are under 45 years old and are totally removed from vibration exposure, they have a chance of reversing the symptoms. If the worker is older than 50, the chances are that symptoms will not reverse, even with removal from exposure. In some countries, all stage 3 cases and stage 2 cases that are deteriorating are removed from exposure.
This is potentially a devastating consequence for a person who, in general, is going to be at a fairly early stage in their work career. Again, it's frequently, in terms of a dedicated pneumatic tool user, something on the interval of 6 to 8 years after beginning employment. Thinking about people in their late 20s or early 30s, this is potentially a disastrous turn of events if, in fact, this will have a negative effect on their current and future employment.
Workers may not wish to leave the job for any number of reasons: loss of pay, loss of status, insecurity about change, and so forth. Management should be involved with the worker and the medical profession in making a decision about removal from the job so that all the pertinent issues are considered. New workers have to be trained, and those being removed may have to be retrained on another job. Although removal from exposure is paramount, research continues in the area of medical treatment. While there is still no cure for hand-arm vibration syndrome, more effective methods of treating the symptoms have been developed.
There are new categories of medications, primarily those which vasodilate, which cause blood vessels to enlarge, which can be fairly effective in controlling cold-related symptoms. The ones that are most widely used are what are called calcium channel blockers, which are frequently used in the treatment of heart disease, coronary artery disease, and also for blood pressure control. These also have the effect of dilating blood vessels peripherally. One of the disadvantages is that they're not selective to the arms and fingers, and so particularly in younger workers, the side effects may not be tolerable. There are other potential pharmacologic routes for the vascular symptoms. These include drugs which are called alpha blockers, although it turns out that the type of receptor which seems to be most affected in the hand-arm vibration syndrome is not particularly well addressed by the current commercial medications, which is to say there may be pharmacologic interventions over the next several years which will be more selective than the ones which are currently available. I should probably add at the same time that the opposite dimension is also true, that there are a number of medications which are commonly used in medical practice, particularly in terms of coronary artery disease and blood pressure control, for example, the beta blockers, which will tend to make this condition worse.
Although drugs may eventually help patients, they will never be a substitute for the other means of injury prevention that we have covered. The health of workers exposed to vibration depends on the vigilance of everyone. The medical community must carefully diagnose patients, encourage safe and healthful workplace practices, and continue its surveillance, diagnosis, and treatment research. Tool manufacturers must continue to reduce the vibration dose their tools deliver. Managers must look for anti-vibration tools when they buy. Train their workers in the hazards of tool use. Institute administrative controls when necessary. Ensure that proper medical surveillance and follow-up occurs among their workforce. And provide personal protective equipment. Tool users must maintain their tools in good operating order. Use the lightest grip possible to ensure full control of the tool. Abide by rest break rules. Keep their hands warm. Not smoke. And seek a medical assessment when symptoms occur. If enough people are concerned enough and stay concerned enough, the hazards of handheld tools can be minimized.